Welcome back to County Connection. The County Public Health Laboratory is now able to test for the novel coronavirus, the cause of the respiratory disease COVID-19.
This is the San Diego County Public Health Lab, and it is one of a select group of labs in the country with emergency use authorization. This new verification means testing for coronavirus, or COVID-19, can be done locally, with test results in 24 to 48 hours instead of several days.
The process before was, as we receive the samples, we have to process, we have to accession them and then ship them to CDC, because at one point in time it was only CDC that's able to do the testing.
The COVID-19 testing requires a detailed, multi-step process. The lab can run up to 40 tests a day, with the ability to expand that number if necessary.
We're online, it's fully implemented. It was verified yesterday, and we passed the validation, we passed the verification, and so now we're able to offer this to the residents of San Diego.
Patients who test negative for coronavirus will be cleared much sooner to return to their normal routines. A positive test will require confirmation from the Centers for Disease Control in Atlanta. Those patients will remain under isolation.
This is really what it shows, is what is public health is all about. How do we work all together to really mitigate the issue?
Mitigate, prevent, and protect. In the County News Center, I'm Anita Lightfoot.
If you're a landlord and would like to make a difference in someone's life, this program might be for you.
Hi, Rose. It's so nice to see you.
I know, I saw you earlier. I've lived here 18 years. I have so much stability. I'm happy.
Rosalind Gannon enjoys her independence. Over the past 2 decades, she has watched rent in San Diego skyrocket. But Rose has been able to stay in her home with support from the county's Section 8 housing program and her landlord.
Section 8 housing is rental assistance for low-income families, elderly, disabled, and it helps people afford a safe and decent place to live.
When I first moved in, it was only $850. I probably could have made it by the skin of my teeth, but then, the rent went up, to $1,200, and now it went up to $1,300 and some dollars. And with me only making $930 a month, never happened.
In our program, the tenant pays approximately 30% of their income toward rent, and the housing authority pays the rest directly to the landlord.
Wow, you just brought me back. They don't call it Price Club anymore. Remember the days they called it Price Club?
Yes.
Now it's Costco. And so I looked into it and I thought, that's wonderful. We're helping others. At the same time, we're guaranteed the bulk of the rents each month, even if the tenant were not to make their portion of rent on time, so that I could still pay my mortgage.
Rose knows all too well what it's like when you don't have enough money to pay the mortgage.
Times were bad. I lived for 4 days in the street, and I had to hawk my rings to get me my dilantans.
On a daily basis, we see people come into our office asking for rental assistance help. We also know that the families that we assist without our help may have to make difficult choices, like having to double or triple up in a home, or even face homelessness.
Many can't afford food or health care. At 70, Rose suffered a bad fall and could no longer work. Housing assistance keeps her in her home because she already has a place to rent. And that's where Section 8 relies on landlord participation.
There we go.
Any landlord who is not considering taking Section 8 housing is losing out on a good rent, a rent that is paid on time, and really high quality renters.
I'm very grateful for Nikki and Merrill.
This has all worked out for you, for us, and we just love the program.
It's nice to come home to my own place. I'm just so happy, what can I say?
In the County News Center, I'm Anita Lightfoot.
When was the last time you had your blood pressure checked? San Diegans from a variety of backgrounds explain how high blood pressure has affected themselves or loved ones.
It is a silent killer, high blood pressure, which is hereditary in a lot of our families, along with high cholesterol. And when we don't take it seriously, we suffer, our family members suffer.
I was in my mid-20s and took care of myself. I ate a vegetarian diet,
I worked out twice a day. Sometimes I would rock climb pretty consistently. It was just, I lived an active lifestyle, so that was not something I associated with high blood pressure, but it's pretty common when you're Latino.
You can be the healthiest person and still have high blood pressure and still have the repercussions like a heart attack or a stroke down the line, and those are the things we prevent by controlling our blood pressure.
You know, we go to the doctor, but we don't know anything about numbers and the importance of your numbers. So teaching everyone to recognize what numbers you should be at and what numbers you can make a change.
My mom died from CHF, which is congestive heart failure, several years ago. And just recently, my sister passed in December the 11th from a heart attack.
My father suffered from heart disease and died very young at the age of 55 from major complications from his heart disease. 2 years ago, I was diagnosed with high blood pressure, even though I was doing all the right things in my day-to-day life in terms of exercising and eating healthy foods.
They told me to go to a doctor immediately. I thought the machine was broken. The nurse thought the machine was broken, so she got a different machine. But it was consistently showing me with over 185 on my blood pressure.
My mom died from heart problems and my aunt. So two of her sisters and herself. So it became a passion to kind of know what to expect when it comes to your heart.
We didn't grow up understanding about heart disease. We didn't have that knowledge.
Didn't ask, didn't think to ask. It just wasn't on my radar.
You don't feel it, you don't know what's happening, and it can't always be treated just through lifestyle alone.
What can I do to try to make sure myself, my sisters, and my children is aware of the things that they can change to make a difference?
We took this knowledge on to save our lives because in our history it was just a lot of pork and beef.
So just find out what is your blood pressure, and anytime you're in the doctor's office, ask what your blood pressure reading was and whether or not it was in the good range or of a concern.
Just want to be here for someone. I think one of the things we did at the first meeting was decide who you want to be here for. And sometimes it might be just for yourself.
I could have been one of those people that you heard about that went to go run a couple miles or did some other form of exercise and died of a heart attack. And now I get to enjoy the fact that I am a father.
Julian is gorgeous this time of year, and William Heise County Park is definitely worth a visit. And while you're there, be sure to hit the family-friendly Cedar Trail. To see more stories like these, follow us on social media or visit countynewscenter.com.